Welcome to Path to Nursing. Let's practice 30 NCLEX-style questions with detailed rationales. Question 1. A nurse is assessing a client with newly diagnosed hypertension. Which blood pressure reading confirms stage 2 hypertension? A. 118/76 mmHg. B. 126/78 mmHg. C. 138/88 mmHg. D. 148/94 mmHg. Correct answer, D. 148/94 mmHg. Rationale. According to current hypertension guidelines, stage 2 hypertension is a systolic blood pressure of 140 mm of mercury or higher or a diastolic blood pressure of 90 mm of mercury or higher. A reading of 148/94 mmHg meets the criteria. Option A is normal. Option B is elevated. Option C is stage 1 hypertension. Question 2. Which assessment finding is most commonly associated with chronic hypertension? A. Persistent headache. B. Severe abdominal pain. C. Sudden hearing loss. D. Productive cough. Correct answer, A. Persistent headache. Rationale. Hypertension is often called the silent killer because many people have no symptoms. When symptoms do occur, headaches are among the most common. Question 3. The nurse teaches a client with hypertension about lifestyle modifications. Which statement by the client indicates understanding? A. I'll add more salt to my meals. B. I'll exercise regularly and reduce sodium intake. C. I'll stop taking my medication once my blood pressure improves. D. I'll only take my medication when I have headaches. Correct answer, B. I'll exercise regularly and reduce sodium intake. Rationale. Lifestyle changes are essential in hypertension management and include regular physical activity, sodium restriction, weight management, smoking cessation, limiting alcohol intake. Medication should be taken as prescribed, even when blood pressure improves. Question 4. Which organ is most commonly damaged by uncontrolled hypertension? A. Kidneys. B. Appendix. C. Gallbladder. D. Pancreas. Correct answer, A. Kidneys. Rationale. Chronic hypertension damages blood vessels throughout the body, especially those in the kidneys, heart, brain, and eyes. Hypertension is a leading cause of chronic kidney disease. Question 5, SATA. A nurse is teaching a client about the DASH diet. Which food should the nurse recommend? Select all that apply. A. Fresh fruits. B. Vegetables. C. Whole grains. D. Processed meats. E. Low-fat dairy products. Correct answers, A, B, C, E. Rationale. The DASH diet emphasizes fruits, vegetables, whole grains, low-fat dairy products, lean proteins, nuts and legumes. Processed meats are high in sodium and should be limited. Question 6. Which medication is classified as an ACE inhibitor? A. Lisinopril. B. Metoprolol. C. Amlodipine. D. Hydrochlorothiazide. Correct answer, A. Lisinopril. Rationale. ACE inhibitors end in pril. Examples include lisinopril, enalapril, ramipril. They lower blood pressure by blocking the formation of angiotensin II. Question 7. A client taking hydrochlorothiazide should be monitored for which electrolyte imbalance? A. Hypernatremia. B. Hypokalemia. C. Hypercalcemia. D. Hypermagnesemia. Correct answer, B. Hypokalemia. Rationale. Thiazide diuretics increase potassium excretion, placing clients at risk for hypokalemia. Nurses should monitor potassium levels and assess for muscle weakness and cardiac dysrhythmias. Question 8. A client with hypertension suddenly develops a blood pressure of 210/120 mmHg and blurred vision. What is the nurse's priority action? A. Recheck the blood pressure in 24 hours. B. Notify the healthcare provider immediately. C. Encourage the client to walk. D. Offer oral fluids. Correct answer, B. Notify the healthcare provider immediately. Rationale. A blood pressure of 210/120 mmHg with symptoms suggests a hypertensive emergency, which can lead to stroke, myocardial infarction, or kidney injury. Immediate treatment is required. Question 9. Which assessment finding indicates that antihypertensive therapy is effective? A. Blood pressure decreases from 168/96 mmHg to 126/78 mmHg. B. Increased peripheral edema. C. Persistent headache. D. Blurred vision. Correct answer, A. Blood pressure decreases from 168/96 mmHg to 126/78 mmHg. Rationale. A reduction to a controlled blood pressure indicates effective therapy and a decreased risk of cardiovascular complications. Question 10, SATA. A nurse is preparing a client with hypertension for discharge. Which teaching points should be included? Select all that apply. A. Check your blood pressure regularly. B. Take medications exactly as prescribed. C. Limit sodium intake. D. Stop medications once your blood pressure is normal. E. Maintain a healthy weight. Correct answers, A, B, C, E. Rationale. Proper hypertension management includes regular blood pressure monitoring, medication adherence, sodium restriction, weight management, healthy lifestyle habits. Antihypertensive medications should not be stopped without consulting the healthcare provider, even if blood pressure is well controlled. Question 11. A client with hypertension asks why blood pressure medications must be taken every day. What is the nurse's best response? A. You only need them when you have a headache. B. They help control your blood pressure and reduce the risk of complications. C. They cure hypertension permanently. D. They should only be taken when your blood pressure is above 140/90 mmHg. Correct answer, B. They help control your blood pressure and reduce the risk of complications. Rationale. Antihypertensive medications control blood pressure but do not cure hypertension. Consistent use reduces the risk of stroke, heart failure, kidney disease, and myocardial infarction. Question 12. Which assessment finding indicates possible target organ damage from long-standing hypertension? A. Clear lung sounds. B. Blood pressure of 118/76 mmHg. C. Protein in the urine. D. Warm, dry skin. Correct answer, C. Protein in the urine. Rationale. Proteinuria may indicate kidney damage caused by chronic hypertension. Damage to the renal blood vessels allows protein to leak into the urine. Question 13. A nurse is caring for a client receiving metoprolol. Which finding requires immediate follow-up before administering the medication? A. Blood pressure 136/82 mmHg. B. Heart rate 48 beats/min. C. Respiratory rate 18 breaths/min. D. Temperature 98.6 degrees Fahrenheit 37 degrees Celsius. Correct answer, B. Heart rate 48 beats/min. Rationale. Metoprolol is a beta blocker that lowers heart rate. A heart rate below 60 beats/min may indicate excessive bradycardia. The nurse should assess the client further and notify the healthcare provider before administering the medication. Question 14. Which instruction should the nurse include when teaching a client taking lisinopril? A. Increase your salt intake. B. Expect a persistent dry cough. C. Stop taking the medication if your blood pressure improves. D. Drink grapefruit juice daily. Correct answer, B. Expect a persistent dry cough. Rationale. A dry cough is a common side effect of ACE inhibitors. If it becomes bothersome, the healthcare provider may prescribe an ARB instead. Question 15, SATA. A nurse is teaching a client about ways to reduce blood pressure naturally. Which instructions should be included? Select all that apply. A. Exercise regularly. B. Reduce sodium intake. C. Stop smoking. D. Maintain a healthy body weight. E. Eat processed foods frequently. Correct answers, A, B, C, D. Rationale. Lifestyle modifications include regular physical activity, sodium restriction, smoking cessation, weight management. Processed foods are often high in sodium and should be limited. Question 16. Which client is at greatest risk for developing hypertension? A. A 22-year-old marathon runner. B. A 30-year-old with no family history of hypertension. C. A 67-year-old who is obese and smokes. D. A healthy adolescent. Correct answer, C. A 67-year-old who is obese and smokes. Rationale. Major risk factors include older age, obesity, smoking, diabetes, physical inactivity, high sodium intake. Question 17. A client is diagnosed with a hypertensive emergency. Which assessment finding supports this diagnosis? A. Blood pressure 214/126 mmHg with blurred vision. B. Blood pressure 136/82 mmHg. C. Blood pressure 128/78 mmHg after exercise. D. Mild fatigue after work. Correct answer, A. Blood pressure 214/126 mmHg with blurred vision. Rationale. A hypertensive emergency involves a severely elevated blood pressure with evidence of acute target organ damage, such as visual disturbances, chest pain, altered mental status, or kidney injury. Immediate treatment is required. Question 18. Which food selection by the client indicates a need for additional teaching about a low-sodium diet? A. Fresh vegetables. B. Grilled fish. C. Canned soup. D. Fresh fruit. Correct answer, C. Canned soup. Rationale. Canned soups are often high in sodium. Clients with hypertension should choose fresh or low-sodium alternatives whenever possible. Question 19. A nurse is evaluating a client taking amlodipine. Which side effect should the nurse monitor? A. Peripheral edema. B. Hearing loss. C. Severe hypoglycemia. D. Hair loss. Correct answer, A. Peripheral edema. Rationale. Amlodipine, a calcium channel blocker, commonly causes peripheral edema due to vasodilation. The nurse should monitor swelling and educate the client to report worsening symptoms. Question 20, SATA. A nurse is assessing a client with uncontrolled hypertension. Which findings may indicate target organ damage? Select all that apply. A. Severe headache. B. Blurred vision. C. Chest pain. D. Decreased urine output. E. Warm, dry skin. Correct answers, A, B, C, D. Rationale. Uncontrolled hypertension can damage multiple organs. Severe headache may indicate increased intracranial pressure or hypertensive encephalopathy. Blurred vision can result from retinal damage. Chest pain may indicate myocardial ischemia or aortic complications. Decreased urine output suggests impaired kidney function. Warm, dry skin is not a typical indicator of target organ damage from hypertension. Question 21. A nurse is caring for a client with hypertension who reports dizziness when standing. What is the nurse's priority action? A. Encourage the client to stand quickly. B. Assess the client's blood pressure while lying, sitting, and standing. C. Discontinue the antihypertensive medication. D. Encourage increased sodium intake. Correct answer, B. Assess the client's blood pressure while lying, sitting, and standing. Rationale. Orthostatic hypotension is a common side effect of antihypertensive medications. Assessing orthostatic blood pressures helps determine whether the dizziness is caused by a significant drop in blood pressure upon standing. Question 22. Which client statement indicates an understanding of home blood pressure monitoring? A. I'll check my blood pressure only when I have a headache. B. I'll measure my blood pressure at the same time each day. C. I'll drink coffee before checking my blood pressure. D. I'll cross my legs while taking my blood pressure. Correct answer, B. I'll measure my blood pressure at the same time each day. Rationale. Consistent blood pressure measurements should be taken without smoking or drinking caffeine for at least 30 minutes beforehand. Question 23. Which finding indicates that a client is at increased risk for hypertension? A. Body mass index, BMI, of 34 kilograms per square meter. B. Daily exercise for 45 minutes. C. Low sodium diet. D. Normal body weight. Correct answer, A. Body mass index, BMI, of 34 kilograms per square meter. Rationale. Obesity is a major modifiable risk factor for hypertension. Excess body weight increases cardiac workload and vascular resistance, contributing to elevated blood pressure. Question 24. The nurse is caring for a client experiencing a hypertensive emergency. Which medication should the nurse anticipate administering? A. Intravenous nicardipine. B. Oral acetaminophen. C. Subcutaneous insulin. D. Oral calcium supplements. Correct answer, A. Intravenous nicardipine. Rationale. A hypertensive emergency requires rapid but controlled reduction of blood pressure using intravenous antihypertensive medications such as nicardipine, labetalol, or sodium nitroprusside while closely monitoring the client. Question 25, SATA. A nurse is teaching a client with hypertension about reducing cardiovascular risk. Which instructions should the nurse include? Select all that apply. A. Exercise at least 150 minutes each week. B. Stop smoking. C. Limit alcohol intake. D. Eat more processed foods. E. Maintain a healthy weight. Correct answers, A, B, C, E. Rationale. Lifestyle modifications reduces cardiovascular risk. Processed foods are often high in sodium and unhealthy fats and should be limited. Question 26. Which assessment finding requires immediate intervention? A. Blood pressure of 218/124 mmHg with confusion. B. Blood pressure of 132/78 mmHg. C. Heart rate of 76 beats/min. D. Respiratory rate of 18 breaths/min. Correct answer, A. Blood pressure of 218/124 mmHg with confusion. Rationale. Severely elevated blood pressure accompanied by confusion suggests a hypertensive emergency with possible cerebral involvement. Immediate intervention is required to prevent permanent organ damage. Question 27. A client taking hydrochlorothiazide reports muscle weakness and leg cramps. Which laboratory value should the nurse review first? A. Potassium level. B. White blood cell count. C. Hemoglobin level. D. Platelet count. Correct answer, A. Potassium level. Rationale. Hydrochlorothiazide can cause hypokalemia, which may lead to muscle weakness, leg cramps, fatigue, and cardiac dysrhythmias. Monitoring potassium levels is essential. Question 28. Which client demonstrates the greatest understanding of hypertension management? A. I'll stop taking my medication once my blood pressure is normal. B. I'll continue my medication even when I feel well. C. I'll double my medication if my blood pressure is high. D. I'll only check my blood pressure at the doctor's office. Correct answer, B. I'll continue my medication even when I feel well. Rationale. Hypertension is usually a lifelong condition requiring ongoing treatment. Medication should never be stopped or adjusted without consulting the healthcare provider. Question 29. The nurse is evaluating the effectiveness of antihypertensive therapy. Which finding indicates that treatment has been successful? A. Blood pressure decreased from 170/98 mmHg to 126/80 mmHg. B. The client reports frequent headaches. C. Peripheral edema has increased. D. The client develops blurred vision. Correct answer, A. Blood pressure decreased from 170/98 mmHg to 126/80 mmHg. Rationale. A reduction to a controlled blood pressure significantly decreases the client's risk for stroke, myocardial infarction, heart failure, and kidney disease. Question 30, SATA. A nurse is preparing a client with hypertension for discharge. Which instructions should the nurse include? Select all that apply. A. Take your medications exactly as prescribed. B. Monitor your blood pressure regularly at home. C. Follow a eating plan. D. Report severe headache, chest pain, or vision changes immediately. E. Stop taking your medication once your blood pressure returns to normal. Correct answers, A, B, C, D. Rationale. Proper management of hypertension includes: A. Taking medications consistently helps maintain blood pressure control. B. Home blood pressure monitoring helps evaluate treatment effectiveness. C. The eating plan emphasizes fruits, vegetables, whole grains, lean proteins, and low-fat dairy while reducing sodium intake. D. Severe headache, chest pain, or vision changes may indicate a hypertensive emergency and require immediate medical attention. E. Antihypertensive medication should not be stopped without guidance from the healthcare provider, even if blood pressure is well controlled.
What was your score out of 10? Comment below. Don't forget to like, subscribe, and share this video with a friend who's preparing for the NCLEX. See you in the next practice session.